Hi, my name is Greg Browne, and I am the Divisional Chief of Vascular Surgery here at Eastern Health. I'm a vascular surgeon at St. Clair's Hospital. In the vascular lab, we study arteries, and specifically the carotid arteries, which supply blood to the brain. If you have narrowing of these arteries, you can have a stroke, and our job is to identify these narrow arteries and to prevent strokes. People who have symptoms of a stroke or mini stroke are people who need the test, and if you have symptoms, you need the test immediately. The symptoms would be weakness of one side of the body or the other, transient blindness in one eye or the other, or a loss of the ability to speak or swallow. If you have any of those symptoms, even if they only last for seconds or minutes, you should have this test, and the test needs to be done urgently. So remember, fast: face, arms, speech, time. Do you have weakness in your face, in your arms? Are you not able to speak? If any of those things happen, you need to get to an emergency department fast. The timing is important because if you have a TIA or a mini stroke, as some people call it, you are at risk for having a stroke, and that risk is immediate. So we really do need to have you tested because we like to operate on appropriate patients within 48 hours to prevent strokes. People who don't need testing are folks with global symptoms such as dizziness, syncope, which is a faint, pre-syncope, which is pre-fainting, neck pain, ringing in the ears. Those are symptoms that are not high risk for stroke and not high risk for carotid stenosis, and those people don't need to be tested.